Hi, everyone, and thank you for joining us today for the fourth installment of the expert series on the COVID-19 pandemic. My name is Christina Wolney. I'm a part of the partner experience team here at Q-Centrix, and today we will be talking with Sara Bienvenu, who is our clinical consultant of advisory solutions on infection prevention as it relates to the pandemic. Sara comes to us with over 25 years of nursing experience with 10 in infection prevention, promoting patient safety with data management strategies and change management. Prior to joining Q-Centrix in 2018, Sara served as the Corporate Infection Prevention Manager for HCA, where she developed and led the training for standardized infection prevention workflow for 168 acute care hospitals. So without further ado, I'd like to introduce Sara and have her tell us a little bit about herself.
Hi, Christina, and thank you for the introduction. I'm a registered nurse, and I have a Master's of Nursing and Healthcare Systems Management. I'm also CIC certified in infection prevention. Patient safety and infection prevention are my passion, and now more than ever, infection prevention plays a key role as we work together to battle COVID-19 and develop strategies to prevent the spread of the virus and provide safe care to COVID-19 and non-COVID-19 patients.
Thank you for that background, Sara. We're happy to have you here today, and I'm excited to dive in. So as you know, this pandemic has required us to be flexible and adapt a day-by-day change mindset. So can you tell us a little bit about some of the things that our partners are doing to successfully reduce COVID-19 mortality rates?
Yes, across the country, many hospitals are running public service announcements to raise community awareness on the preventative steps that each of us can take to keep ourselves, our families, and our neighbors safe. This is the first line of defense to keep the number of positive COVID-19 cases low so that healthcare facilities have the capacity to care for the sick. Patient outcomes are at risk when hospitals are overwhelmed by patient surge. Many hospitals are working to address health disparities in vulnerable populations. Iberia Medical Center in Louisiana is running a public service announcement highlighting the disproportionate number of deaths among Black patients with COVID-19 and stressing the need for steps to prevent and save lives. In Louisiana, 32% of the population is Black. However, the COVID-19 death rate for Black residents has been as high as 70%. We're seeing this disparity in other areas of the nation as well. The American Hospital Association is calling for hospitals to assess and document socioeconomic information on COVID-19 patients to help in identifying vulnerable populations and hotspots within our community. More than ever, it's important that we perform social assessments to help identify patients' risk of exposure to COVID-19 in their homes and their work environments, and to also bring social workers into their care to help facilitate and support the patient and family's social needs. There's still a lot that we don't know about COVID-19 and how to treat those seriously ill. A major NIH study released promising results showing that the antiviral remdesivir can decrease time to recovery. And for some patients, this may mean less days on a ventilator and less lung injury. In New Orleans, pulmonary critical care physicians at LSU are using non-invasive ventilator instead of intubating some seriously ill COVID-19 patients. They're intubating less patients, and those treated with this non-invasive ventilation are showing better outcomes. This innovative approach also helped to prevent a ventilator shortage during the peak of the COVID-19 crisis here in New Orleans.
That's great that our partners have implemented those tactics and are working to flatten the curve. It looks like those measures, along with tactics that the general public are using, are helping to decrease the amount of cases in the US. But we're also seeing the temperatures increase for spring and summer weather. So as an infection preventionist, what recommendations do you have for patients, physicians, and hospitals to ensure that there's not a secondary uptick in cases?
As facilities begin to see patients for non-COVID care, measures to reduce the risk of COVID-19 exposure and transmission to patients and healthcare workers will need to be in place, including screening of staff and patients for symptoms of COVID-19 prior to entry. Some facilities may designate non-COVID care entry zones, cloth face coverings for patients and accompanying family members when they're allowed, prohibiting visitors except where necessary, only allowing when necessary for aspects of patient care. Facilities are partnering with local and state authorities and evaluating these visitation policies. Administrative and engineering controls to facilitate social distancing, such as limiting numbers of patients in waiting areas, spacing chairs at least 6 feet apart. Hospital staff will be using CDC's universal source control recommendations. Healthcare workers wearing surgical masks at all times, and the use of N95 respirators and face shields when performing high-risk aerosolized procedures. For example, here in New Orleans, all healthcare workers are wearing masks and no visitors are allowed at hospitals except for certain scenarios such as for laboring women. Ongoing, we'll need to be mindful to conserve personal protective equipment for our healthcare workers in the event of a patient surge.
Thanks, Sarah. And along the same lines, hospitals are reopening for elective procedures. How can they avoid cross-contamination of COVID-19?
Screening patients and staff for symptoms of COVID-19 prior to entering hospitals is a basic measure to decrease the risk of exposure and transmission. When testing capacity is available, CMS has recommended COVID-19 testing to screen patients before care. COVID-19 testing could become a part of preoperative testing for planned surgeries. Regular screening of staff providing non-COVID-19 care is another measure which may be introduced as testing becomes more available. As facilities reopen for non-COVID care, plans will need to be established to address deep cleaning and disinfection of patient care spaces and medical equipment. Facilities will need to continue to monitor the incidence of COVID-19 in their regions and should cease non-essential procedures in the event of a surge.
Thank you again, Sarah. So as you've seen, crisis within healthcare really forces us to redefine care. What best practices are you seeing emerging out of this pandemic, and how are we now looking at our response to pandemic situations moving forward?
We've had to learn some very hard lessons during this pandemic, experiencing critical shortages in supplies such as ventilators, personal protective equipment, N95 respirators. As a nation, we need to take steps to evaluate our supply chain and address areas that put us at risk, such as reliance on other countries for critical supplies and drugs. Re-evaluation of emergency preparedness plans will be a priority at the facility and state level. In particular, this pandemic has emphasized the importance of emergency stockpiles of critical supplies. Some healthcare systems, such as HCA, have their own emergency stockpile. State planning and funding of emergency stockpiles is needed to plan for future pandemics and natural disasters.
Definitely, Sarah. And as you know, Q-Centrix partners with more than 650 hospitals throughout the country. How can folks optimize their partnerships, and how should we best be supporting people during this time?
We have actually added new partners who are seeking relief for their infection preventionists during this pandemic. This is at the core of what we do. Support infection prevention by taking on the work of HAI surveillance and public reporting so that facility infection prevention resources can address immediate priorities, which today are COVID-19. We've heard from many facilities that even though CMS is not requiring HAI reporting into NHSN for the first and second quarter of this year, but they still wanted to continue concurrent HAI surveillance during this pandemic to keep a pulse on patient safety and infection trends at this time.
Thank you, Sarah. And I think this is all extremely important as we move forward with this global pandemic. Unfortunately, we're almost out of time today. So do you have any closing remarks for listeners?
Well, during this pandemic, COVID-19 has been referred to as the invisible enemy. This virus has heightened everyone's awareness of the importance of infection prevention measures such as hand hygiene, respiratory etiquette, and appropriate use of personal protective equipment when caring for patients. There are other invisible enemies such as C. difficile, CRE, MRSA. Let's take the lessons that we've learned from this highly infective virus as a reminder that we can break the chain of infection for COVID-19 as well as those other invisible enemies as we provide care for our patients.
Absolutely, and I really appreciate your time and insights today. I'm looking forward to learning more from the other Q-Centrix experts as we move forward through this series. Thank you to everyone that has joined us today, and please stay tuned for the next video in this series. Thanks.